Good afternoon, Dr. Ida Khanum, Pediatric Board Concierge Pediatrics in Bel Air, Houston. So again, I had another question from somebody who basically wanted to know the side effects of Leucovorin, and I wanted to explain that there are certain side effects that happen in some children. So I've been prescribing this for a while now. So most of them have nothing. Some may have little fatigue, which goes away in about 10 days. Some may have a little more hyperactivity, which should also go away within 10 days to 2 weeks. Maybe a little bit of a rash, maybe a little bit of GI upset, like a little diarrhea, but all of this should resolve by the 2 week mark, okay? And that's really what we want to kind of see. And we always start the medication at a very low dose, hoping to have minimum any kind of reaction, so really preventing any reactions and then building up the dosage. But again, if your child does have any of these 4 or 5 things, it takes about a week, 10 days, and then it usually tends to resolve and the child does fine, and then we just slowly progressively increase the dosage. So those are really indications where we don't really need to stop the medication. You just wait to work it through and the child should do better. True indications to stop the medicine is a real allergic reaction where your child has hives or oral swelling or difficulty breathing or a seizure. But if they haven't had any of those, typically we can continue. Now again, if aggression is progressing and it's going more than 2 weeks, it's becoming the child is just really not able to control it, then sometimes we can go down on the dose or we may need to stop the medicine. But I just wanted to come on board and just share, because often parents will be like, well, how long should I wait? Will this go away? It's usually at least 10 days to 2 weeks, and then it tends to settle down. That's the feedback we've got from most of our patients.